Finally tonight, worries over a potential Zika outbreak in the U.S. and who may suffer a bigger impact. Public health officials have been increasingly concerned about the virus spreading via mosquitoes this summer. One report even suggested government officials were split over whether to advise women to avoid pregnancy in areas where Zika is circulating. In an op-ed titled "Zika is Coming," Dr. Peter Hotez focused on some of these questions and what it might mean in some cities in the southern parts of the country. He's the dean of the National School of Tropical Medicine at Baylor College of Medicine and a pediatrician and microbiologist at Texas Children's Hospital. I interviewed him from our New York studios. I want to read you the first sentence of the op-ed that you wrote in the New York Times recently. It said, "If I were a pregnant woman living on the Gulf Coast or in Florida in an impoverished neighborhood in a city like Houston, New Orleans, Miami, Biloxi, Mississippi, or Mobile, Alabama, I would be nervous right now." Explain.
Well, the reason I made that statement, Hari, was because what we know where this terrible birth defect microcephaly is happening. It happens when pregnant women are bitten by the Aedes mosquito. So the first requirement is it has to be a part of the world where we have the Aedes mosquito. It also, the other component that not many people appreciate is both crowding and poverty. And the reason why poverty is so important is because women who live in poverty have increased exposure to mosquitoes because of absent or broken window screens, collected garbage, environmental degradation near the home that breeds mosquitoes. And so what you have on the Gulf Coast of the U.S. is the perfect storm of all three factors: the Aedes aegypti mosquito, the extreme poverty and crowding that you would find in northeastern Brazil, which is the epicenter of this epidemic, or what we've seen moving into Colombia. So for all the reasons we're seeing microcephaly cases appear in Brazil and Colombia, where I believe we're going to see on the Gulf Coast, especially as we move into the warmer months when our mosquito numbers start to rise. So we're already finding Aedes aegypti mosquitoes on the Gulf Coast, including here in Houston. But I'm very worried that as we go into the warmer months, those mosquito numbers are going to climb, and with it, the poor neighborhoods on Gulf Coast cities such as Houston, New Orleans, others are really going to be affected by Zika.
So what's that timeline of progression that you see? Not all mosquitoes have Zika. It'll take some time for some of them to get Zika, and then some of them to bite people, some of those people to have symptoms, some of those symptoms to be severe.
Well, arboviruses, viruses transmitted by mosquitoes, are not new to the Gulf Coast. We've experienced a number of epidemics of arboviral infections. For instance, in 2003, Houston experienced an epidemic of dengue fever caused by the same Aedes aegypti mosquito. And what we found was those numbers started to rise in May and into June, and with it, we then started seeing a dengue outbreak back in 2003. So I would expect if Zika is going to strike the Gulf Coast, it would go by a similar playbook. Beginning in May, June, into the summer months is when we could start seeing Zika transmission on the Gulf Coast.
Should local health officials be advising women to delay pregnancy?
Well, it depends really where we're talking about. So right now, Zika is rampaging through Puerto Rico. According to the CDC, maybe half or even more of the island is going to be infected by the Zika virus within the coming weeks. And this is how Zika goes. It affects an immunologically naive population and sweeps through it very quickly over a period of months. We saw this in Micronesia, in French Polynesia, in Brazil, and now in Puerto Rico. So during that time period, I'm of the opinion that if it's possible to try and delay pregnancy during that time when large numbers of women are getting exposed to the Zika virus. Having said that, it's easier said than done. We have to remember the problem of advising women to delay pregnancy. Who is Zika affecting? It's affecting predominantly women who live in poverty, not exclusively, but disproportionately affecting women who are impoverished. So it's a very tough call. Right now, we do not have Zika virus transmission on the Gulf Coast. So I would not make that recommendation, but it's something that we're going to have to revisit as we get into the warmer months.
What about the idea of false positive cases that have happened in Brazil, and that so many Zika infections don't even lead to the equivalent of a cold or a mild fever?
Well, we're starting to change our opinion on the virus. You know, we used to say that 80% of cases are without symptoms, asymptomatic. That's probably an overestimate. The real question we'd like to know is if you're a pregnant woman and you become infected with the Zika virus, what's the likelihood you're going to give birth to a baby with microcephaly or other terrible congenital birth defects? So the stakes are very high. I think for now we have to assume that if a mother is infected with Zika virus, the likelihood that she'll give rise to a baby with that she'll give birth to a baby with microcephaly is significant, and we have to plan accordingly.
Dr. Peter Hotez from the Texas Children's Hospital and Baylor College of Medicine, thanks so much.
Thanks for having me.